most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
we're going to show you how to stop knee pain fast. We got 3 key exercises. Plus, we're gonna fix your hyperextension.
Right. We'll show some posture of the leg or the knee to help that irritation.
A lot of people probably don't know what hyperextension is, but we'll show you.
Right. Mm-hmm.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. Always giving something away. This week, we're giving away a Thermotex far infrared heating system.
Right.
This is awesome, especially if you have pains like back pain or upper shoulder pain.
The big advantage, it's far infrared. It goes much deeper, over 2 inches into the tissue versus a normal hot pack goes, just skin deep, basically.
I bet you a lot of people don't know that, but regular heat only goes very surface.
Yeah, superficial.
Yeah,
skin deep. I said that, Bob.
I don't. I was clarifying. Okay, you can also go to Facebook. The contest will be pinned to the top of the page.
Right up there.
Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Yeah, and we have the podcast out right now as well, which is very nice. We have some outstanding authors and guests.
All right, why don't we go to work, Brad?
Okay, Bob. So I do want to say this is a little not selfish, but unselfish. I want to make this video for Mark. Okay, he's going to be my daughter.
Mark.
He's going to be my daughter's father-in-law.
Oh,
yeah. Anyways, he had a hip surgery. Things are going very well, but he does have some knee problems.
Both sides?
Yeah. I believe just one side primarily. There is some hyperextension involved, which is not uncommon. A lot of people aren't aware that their knee pain is from the knee hyperextending.
Yeah, you're really jamming the knee when you do that.
And when people are standing, they're not aware that their knee is, because you really can't see it that well unless you're really looking for it or your pants legs or something. When the knee is hyperextended, the joint is at an end range, and that can really irritate the cartilage.
I'm a prime example of this, Brad. I was doing this in my 20s, and I had to work my way out of it.
Yeah.
My knee was getting so hyperextended. I was having so much pain.
Oh.
Well, look at it right now. I got tape on it right now, but watch. Can you see how far back that's going?
So the joint is going too far back. There's one trick we're going to show you. This is optional to do. You could just think about it, look down and make sure that you're not hyperextending, maybe a slight bend in it, not enough so you could see it. You can take kinesio tape, which you can get online. You can get it at a pharmacy, and it stretches. And you
put it on with the knee slightly bent.
Yeah, so you put it on and get it to tack down. There we go. And now this is not sticking because Bob's leg isn't clean. And it is a little moisture in here because it's warm in here. But anyways, when you extend your knee, what happens is the tape tightens up and you feel it stretch. And it gives you a little biofeedback, and you don't have to think about it so much.
Because believe me, a lot of people, I tell them to do this, to keep their knee slightly bent, and I'll observe them in the clinic. And what are they doing?
They're locked out. It's a habit.
It's a habit, right?
I'm not aware of it.
Let me tell you, I treated one kid that was 20 years old. They worked at Subway. That's all we changed on him, was to have him stand with his knees bent.
Just slightly bent.
And his knee pain went away.
Yeah, very good.
That's how bad it can be.
So very important. Be aware of it. We're going to show you some exercises that are going to help that as well. This next one is something we just came across.
It's Ben Patrick, knees over toes guy.
Yep. Simply walking backwards. Now, you're not going to walk around backwards to get around. This is where you're going to do some therapeutic walking backwards, and with a little resistance. And I think the best,
and really safety first here too, especially Mark, after you've had a hip replacement, we don't want you walking backwards.
Right, unless the doctor says it's okay, because one of the precautions with he has an anterior hip. If you have a posterior hip, it's not a problem, but you don't want to extend the hip.
Right.
It stresses the surgical site. But after so many weeks, the doctor is going to say, it's okay.
It's okay.
And I think Mark is now getting close to that point, but I'm saying just hold off on it yet. But what we do is, if you have a strap, these stretch straps, these exercise bands, You're going to anchor it around something very solid. We're going to use the wall anchor, which goes on the wall, but you could go around a bedpost if you got a heavy bedpost, handrail on a stair,
Sure.
and you just
Really heavy table.
hold
maybe.
it, and then you just simply walk backwards.
Yep.
And you have a limit by the band, of course.
But it gives you a little balance too. But
Yep. So you're working some core. It's a nice, more than just the knees. And when you walk backwards, the muscles and the mechanics of the knee, it takes stress off the knee. And that's what Ben, what's his last name again?
Patrick.
Patrick. Is it Patrick Ben?
No, it's
It's
Ben
Ben.
Patrick.
Yeah, I think he's got a sense of humor. Now, if you have a loop, these work really nice. Anchor it again. And you go around like this. And the reason they work exceptionally nice is because you can walk backwards and
you're really,
simply
Brad,
turn
as I
around.
watch you, you're really not extending your hip much.
Not really.
Not at all, really.
That's why
That's what's nice about walking against resistance.
Yes.
It actually prevents you from extending the hip.
And this is such an easy way to get the exercise. It's just not a hard exercise, but it's doing what it's supposed to do.
If you have a treadmill, you can also try this. It's actually safe to do. You hang on to the sides of the treadmill and lean against the front of it,
Yeah.
and you walk backwards with the treadmill off.
Off.
Yeah.
Unplug it.
Unplug it, and you can actually make the belt go
Right.
with your feet.
Yep. So
And it
your
gives you a
legs are
little
doing the work.
resistance, yeah.
It's a really neat way to
Yeah.
exercise that way. The next one is quadriceps strengthening. Okay, Bob, why don't you show, this is a real simple isometric way to do it.
You just take a pillow and fold it in half.
Yep.
You're going to put it under your knee.
So you could do this one in bed.
In bed, yep.
Mhm.
And all you're going to do is you're going to push and squeeze the pillow down.
Yeah, let's just pop this out of the way a little bit so you
Right,
can see
sure.
that. There we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And do at least 10 times.
So you squeeze the pillow as hard as you can. You'll feel those quads working.
10 times, then repeat 2 more times. So
Yep.
3 times total, and at least 3 times a week.
Okay. So
Not too
Monday,
much?
Wednesday, Friday.
Sure.
Take the weekend off.
But what you'll find with knee pain, almost invariably, the muscle that gets weak is the quadriceps.
Right, right,
So it's the muscle, number one muscle you want to strengthen with knee pain.
right. And probably the number 2 we're going to talk about is the hamstring.
Sure. Very
I,
easy to do, by the way.
I do know that I like the ball. I use it a lot
Yeah.
for strengthening. And I know Mark has one at home. He
Sure.
says he's going to dig it out. He says he maybe didn't use it so much recently. So
Okay.
like a lot of exercise equipment that happens to. So you put it against the wall, and this is really comfortable. You need to have shoes on, something so your feet stick to the carpet, or if it's a smooth floor, so your feet don't slip out. Shoulder width wide, about 2 or 3 feet out from the wall, so you're like this. And then now you may want to start with a piece of furniture, a cane. We're using the bowling stick, so you have something to balance with. If you have a chair or a cupboard on one side, and you're just going to go down.
What's
and
nice
up.
about these, you can start off very shallow.
Yeah.
We don't want knee pain,
Mm-hmm.
so you can start to the point where it does not hurt at all.
Right. And that might be only to here.
Yeah.
If you get down to here, it's like hurts.
Right.
And we're going to say this. I know knees to the toes, guys, he goes farther than this, but
Right.
I'm going to suggest in this circumstance, when you get down to here and your femur or your thighs parallel to the floor, let's just make that
Right.
in line, because it does take some stress off
Yes,
the
it
knee.
does.
There we
If
go.
the knee calms down, you can go deeper.
Yep, exactly. So we're going to shoot for 10 of these as far as you feel comfortable. Believe me, you'll feel those quads working.
Again, 3 times a week.
Sure.
I wouldn't necessarily feel that you have to do that every day.
Right. I mean, after you've done them for a few weeks, it's feeling good and you feel ambitious, you may want to bump it up.
Sure.
Let's go to the hamstrings.
Sure.
This is my favorite way, but the only drawback is you need to get down on the floor. And if that's not safe, then it's not an option. So if you feel comfortable getting on the floor, you're going to lay down. This is a nice exercise because you can just lay here and kind of relax for a little while, take a
Just
break.
Screwed up, Brad. Did 2 lays in a row.
Oh, no.
Karen is going to
And
be
he's a
upset with you.
teacher. He's
Yeah,
a
oh,
retired
geez.
teacher, but he's, I think, math.
All
so he may
right.
not be
He might be okay.
But his wife, well, I think
Lie down.
lie
He's
on
lying
the
down.
floor. Bring up like this. So you're working core, you're working your hips as well, and your glutes. And we're going to curl up to here and then go back down with good control. And we're going to do 10 of these.
Now, Brad, for the beginner, wouldn't they maybe keep the butt down and
Yep.
just dig your heels in?
Yes.
And
Yep.
right.
So now my butt's on the floor. You can just push into the ball. You get some resistance, and then
curl
do
back.
that.
Yeah.
Once 10 of them like that is easy, then you can lift the
Your
butt up.
Yeah.
The higher the butt, the harder it is.
Yep.
And there's more advanced ones that you go to one leg, but we're not going to
that would be
touch that on this video.
Exactly.
So, and then you simply curl like this. So
Yeah.
you can do this comfortably seated. You can, let's see what happened to my other strap. Oh, there it is. The loop strap works nice and easy. If you do not have one, you do need some kind of a resistant band. You could use one of these and again, anchor it somewhere. The anchor is so handy. You don't even have to take time to do it. And if you got this, you might be able to fit this through your foot, but that's not going to work unless I take my shoe off. But you have to, let's do this.
You can go around.
Yeah. It does not work near as nice as a loop strap, but it's not bad.
Well, a lot of the kits come with cuffs too. You can
Right.
Hook up to the cuff.
Yep. So in other words, there's a Velcro cuff with a steel eyelet on there that you can hook that up more conveniently. So again,
That works out quite well.
shoot for 10 repetitions of that. And
3 sets of 10 usually.
yeah, as you
Yeah.
get better,
As you
3
get-
sets of 10, you can rest between
And
your
usually 3
sets.
times a week.
Mhm. Once again, make sure that you watch your posture with your knee and don't hyperextend it all the time. Make a habit of that. Do the strengthening exercises. And remember, be careful in everything that you do.
That's right.